everyone. We are so excited to have you all join us for our virtual seminar regarding claiming your collagen. And we'll wait for just a couple minutes for some more folks to join, and we will get started. Welcome everyone to our virtual seminar series. We've been doing quite a few of these. Dr. Alfonso has hosted some, and today we're going to be talking about claiming your collagen. So I quickly wanted to introduce Alicia and I. So, Alicia, I'll let you introduce yourself first.
So hey guys, you probably recognize me from the Bankston Center. I've been here for 7.5 years. I'm a certified medical assistant along with advanced training in Ultherapy. I am one of the Ultherapy providers here at the Bankston Center.
Awesome. And I'm Britt Bankson. I recently joined the team here at BCAPS officially, and I'm our laser and energy-based specialist. I also focus as our director of strategic partnerships. So we're really excited to continue to develop protocols to optimize your outcomes and enhance your patient experience. So today we're going to be featuring and talking about Ultherapy and microneedling. We are taking COVID very seriously at our office, and we just reopened on Monday. So I'll jump into the presentation here. So we are back and we are so excited. We're looking forward to welcoming you to the practice if you haven't already had a chance to swing in. So we do have special protocols and processes now in place with COVID. Specifically, we have kind of a check-in station before you even enter the practice where we take your temperature, we'll run through a quick screening, and then in the waiting area, we're spacing patients out as well. We're also very excited to offer virtual consultations. I'm sure everybody might be a little sick of all the Zoom conference calls, but we see this as such a great opportunity where you do not necessarily have to come into the practice, or if you're a little nervous about kind of that person-to-person interaction. I can say that we've had some patients voice those concerns, and then having come in for their appointments earlier this week, the feedback has been incredibly positive. So you'll see the patient experience is a little different here, but we want to make sure that you feel very well taken care of. And we're, of course, offering in-person consultations as well. So first and foremost, I think it's really important to mention the building blocks for healthy skin. And here at the Bankston Center, we have gold standard technologies. Our providers are amazing. And our goal is to really pull together more of a concierge approach to addressing your skin concerns. Today, we're going to be featuring two of those, Ultherapy, which is our skin tightening, saggy skin fix, and microneedling, which is kind of like aerating the lawn, but it really helps to even out your skin tone. So we'll dive into both of those, primarily focusing on Ultherapy today. Another thing we really like to address and look at is the changes that we go through as we age. So from younger skin to older skin, I think that a big trend has really been what can we do preventatively to delay some of those onsets of severe folds, volume loss. But overall, what we see anatomically is our faces go from more of an oval to a square shape. We start to notice dulling of our skin, declining collagen production really becomes one of those key things that we really start to see the effects of that externally with laxity and sagging necks and jowl formation. So the hard truth that we all have to face, but thankfully there's some great skin solutions that we can utilize to really delay, prolong, and even reverse some of those signs of aging. So with that being said, I'm going to hand things off to Alicia and we'll jump into Ultherapy.
Great, thanks, Brittany. So this next slide is going to show a general overview of kind of what the Ultherapy treatment does. Ultherapy is utilizing focal ultrasound energy to stimulate collagen production. Our bodies, unfortunately, stop producing collagen on a regular basis in our 20s. So the lack of regular collagen production is what contributes to our skin laxity, jowl formation, fine lines and wrinkles, and folds near the mouth. Ultherapy delivers a wound directly into your collagen, which is going to prompt your body to create more collagen. This process is going to continue for the next 6 months. So this next slide is showing you how we use the ultrasound for visualization into the tissue to identify the collagen. Reading the ultrasound appropriately is imperative to delivering an effective treatment. We are first going to deliver specific pinpoints of energy directly into the foundational collagen or deep collagen. On this slide, you can see in the right-hand side where we're treating at a 4.5 millimeter depth, 3 or 1.5, and that's all going to depend on your personal collagen and where that is. Each Ultherapy treatment is customized to the individual patient, as no two patients are alike. The next slide explains what you can expect the day of your treatment. So it's first going to include some facial mapping, and that is done with a white eyeliner. We go through each areas of the face to kind of match up with the protocol of the treatment, also identifying and avoiding facial nerves that we don't want to treat over. And then comes the C-Plan Treat program. C is using the ultrasound to identify where your collagen is specifically, coming up with a personalized game plan of treating right into that foundational collagen, and then we're going to treat into the more superficial collagen. And then the treatment starts. Treatment can depend on the time, can depend on the areas that we're treating and how long that those might take. If you were doing a full face and neck treatment, I would probably plan to be in the office for about 2 hours. If you were just simply treating the brow, it might only be about a half-hour treatment. We do offer different comfort measures here at the Bankston Center, depending on what your needs are. They can be anywhere from just as simple as utilizing ibuprofen and Tylenol. We also have the ability to add Pronox, which is a laughing gas that really just kind of takes off the edge of the treatment. It's not that you won't feel it, it's just that you simply don't really care. The third option would be to use some opioids. Usually that's going to include Norco for pain, Xanax for some anxiety, and possibly some Neurontin for the nerve discomfort. So we have lots of different comfort measures that we can make sure that this treatment is very tolerable for you. Then the last point on this slide that I wanted to point out is there's little to no downtime. This treatment is specifically going down into your collagen, so we're really not affecting anything on the skin. You might have a little bit of slight redness during the treatment, but that should resolve itself within the hour after the treatment's completed. The other recovery measures would be possibility for some slight bruising and some pain along the jawline, but they're very minimal at best. So how soon can you expect to see your results? Your body will continue to produce collagen following your treatment and will continue up to 6 months. Your results will start to be visible around that 2 to 3 month mark. So this slide is showing the different technologies that are out there on the market and kind of where they're prompting that collagen level from. So in a facelift, we're going down into that SMAS to create that uplifting, tightening of the procedure. The lasers are going to prompt collagen from a more superficial level. Radio frequency is utilizing heat that's going to produce collagen from another level. And then the Ultherapy is showing that it's a very precise treatment. We're delivering energy right into certain levels. We can see exactly where that energy is going the whole entire time. So really you can see that it's the second most deepest technology that we do next to a facelift. So how many treatments will I need? So that varies from patient to patient, and that's basically how we age. I have some patients that come anywhere from, every year to do the treatment to every 2 years. Here at the Bankston Center, we also offer something that's called a booster treatment. So should you want to have the treatment repeated every 6 months, you can do that at 50% off. So that's a great way to really face the aging process very proactively.
I just wanted to make a quick comment as well. So we have some questions that popped up on the side, one of which is, what age should you start these types of treatments?
That's a great question. I myself am 42. I'll be 43 next month. I started doing these treatments back when I was 35, and I've really noticed that that's helped me really keep a nice, tighter jawline. So it's, again, very proactive in its approach. So the age can really vary. I would say the majority of my patients are going to be anywhere from 40 to 60 years old.
I've had 2 treatments done as well. So I had my lower face treated, and not that I felt I needed a lot of correction in that area, but I always felt like I had a little laxity or wanted a little more defined jawline. The brow area too, I had done my second treatment, and that was great. I don't have a lot of fillers. I started doing Botox, but I think that honestly, for any age, Ultherapy is a fantastic solution, as well as microneedling. So it really depends on your goals. During your consultation, we can pull together a game plan, and it's also based on your budget. I think it really depends on kind of how much you're looking to spend for these types of treatments. We want to make sure that it's something that can really address those things to meet your goals. So we had a question as well about melasma. Can you address that, Alicia?
So the Ultherapy treatment is strictly treating into the collagen. Melasma is more of a pigment issue, so that can be addressed by different technologies that we have, one being microneedling that we will talk about next. The other option could be potential for lasers and also some really good skincare products to keep that at bay.
Definitely. And one more question, and then we'll address some more later on at the end of the session. But one question was, can it be used along with liposuction to contour the jawline?
So I don't believe we do liposuction to contour the jawline. You have a lot of facial nerves there that you want to kind of avoid. You can do liposuction to this area underneath the chin. That's called the submentum. So yes, in that scenario, we could use those in conjunction with one another. And Ultherapy is often used on a patient having surgery and then adding the Ultherapy during that procedure as well.
Yep. Yeah, I think that's what she clarified was for the double chin area. So definitely, that's a great combo solution for patients that really want to see a little more reduction in this area.
Just to add to that, we also offer different options for double chins. We do have liposuction, but we also have the benefit of offering non-surgical options. One of them that you might consider would be cool sculpting to freeze those fat cells underneath the chin. Or we also offer Kybella, which is an injectable that goes in and dissolves the fat. Okay, on this slide, we're looking at the different results that we can expect off of the Ultherapy. This first slide on the left is kind of showing how we get a nice lift in that brow position. As we age, our brows tend to kind of flatten out, leading to excess skin or heaviness in that upper eyelid area. So the brow Ultherapy treatment is just a really nice treatment to kind of lift up that brow and kind of open up that eye area. A lot of people will ask, if I do the Ultherapy to the brow, then do I not need to do the Botox? And my answer is those are two different things. The Ultherapy is, again, lifting the area and opening up the eye, but then we can use Botox or any other type of neuromodulator to kind of smooth out the forehead. So how long does a treatment take? And that's going to vary by the area that we're treating. Again, a brow treatment might simply be a half-hour appointment, ranging all the way up to a full face neck and chest treatment could take about 2 hours. And again, here's a great, some before and afters here of showing, different things that we can expect from the Ultherapy treatment. You can expect some improvement in the jowl formation, kind of tightening up and redefining that jawline. Another aspect is the crepiness that we tend to get in the neck as we age. It's a really nice treatment for creating collagen at that more superficial level to get an improvement in the crepiness. How long does it last? So it takes your body some time to produce that collagen and continue producing that collagen for up to 6 months. So you're going to see those results again 2 to 3 months in, and it can last anywhere from 1 year to 2 years. And that really is just kind of based on the patient and how well that they age.
We have another question too, asking about, can you use Ultherapy if you already have fillers?
Yes, you definitely can. So if you already have existing fillers, that is totally fine. Where your fillers are going to be typically, you know, if you have them like in the cheek area, those fillers are placed deep right on top of that bone. So the Ultherapy is not going to be delivering energy into that bone, making the fillers completely safe. Again, if you have filler in your lip area, the Ultherapy is run kind of around right above the lip border. So again, not interfering with the lip fillers at all.
Mm-hmm. One other comment I would make, we have a lot of patients that ask, you know, what series or order should I do these treatments in? And that's a great question. We can address that during your consultation as well. I always say it's great to kind of work from the inside out. So to utilize laser and energy-based treatments first, and then kind of use filler and Botox, and we can talk about the time frame in which those are typically done. It's always good to ask too, what big event do you have coming up? So if you come in for your consult and you say, hey, I have a friend's wedding coming up, or I have a reunion, or I have a big birthday that's approaching, we can kind of back into a treatment plan to meet your goals that will really have you looking your best.
Yeah, I think you can think of the Ultherapy as kind of being your basement floor up if you're thinking about your skin as a house. And so like Brittany was saying, if you have a specific event coming up, well, you might be looking for something that's more of an immediate gratification, whether that's a filler or a neuromodulator. The Ultherapy is something that in an ideal world, if you have time to invest into a facial plan, you'd want to start with your Ultherapy treatment first and then kind of build from there, whether that includes neuromodulators, fillers, skincare, laser treatments, microneedling. And so on this screen, we're looking at the Ultherapy results on the chest. This is especially important for those patients that tend to sleep on their sides and we start to get those creasing and those wrinkles in our chest. The Ultherapy treatment is very nice for kind of smoothing out those areas of concern on the chest. Ultherapy has won many different awards through different magazines. That previous slide was just showing men. This is a great treatment for men, as men want to make sure that they look and feel their best. That's important, as far as looking young and youthful, for staying relevant in their careers. We see lots of men in the clinic for Ultherapy. Looking at Lori's question about looks like skin texture on the arms. So we don't use Ultherapy for skin texture on the arms. Brittany could possibly talk about this. Profound is another technology that we have in the office that's really beneficial for more of that saggy, superficial skin, I would say, and can be used on the body, such as arms, buttocks, thighs, face.
Mm-hmm. Absolutely. And we'll likely be doing another webinar. I'm not sure the date yet, but we'll have one in our virtual series speaking to Profound. So if you have questions about that during the consult, of course, we can touch base on that. But yeah, move on to the next slide here. Anything else that you want to add, Alicia, in regards to Ultherapy?
The last thing that I wanted to add is that Ultherapy is great for spring, summertime. Not every treatment here in the office can be done when we're out in the sun, as our skin would be susceptible for burning. But the Ultherapy, again, because it's going into that collagen at that foundational level, is a great treatment to pursue in the spring, summer.
We'll jump into microneedling now, and feel free to post your questions on the side. So with microneedling, there are a lot of different microneedling devices out there. And I think that some patients come in with a lot of questions. There's mechanical microneedling, which is what we're talking about today. There's microneedling with energy, and then microneedling with long pulse, which would be our Profound system. So we really cover the full gamut of energy and laser-based technologies. Microneedling is one of those treatments that I think is great for patients of every age. We have different protocols that we've established here in the practice to make sure that we meet those goals. So it's a great treatment to balance texture, and tone. So looking at what those benefits are, basically when we utilize our skin pen, which is the FDA cleared device that we use for microneedling, we're creating controlled microinjuries in the tissue. So almost think about it as aerating the lawn of the superficial layers of your skin. That's really important because it actually allows us to utilize products that are going to penetrate into some of the deeper structures of your skin that typically a lot of our amazing medical grade products don't have an opportunity to get to those depths. So that's really how we utilize microneedling as well, is to deliver those products that we want to those specific depths. So getting back to the question about melasma, typically we want to steer away from any high heat devices. There's no such thing as a cure for melasma, and I believe Luba and I will be talking about managing melasma in a later series as well. But it is important to manage your melasma, and so wearing SPF, wearing sun protection, trying to keep your face cool, those are all wonderful things to do. And the results with microneedling is really new collagen, smoother texture, and a more even skin tone. And one question just popped up about scarring. It is fantastic for scarring. Again, I would say the best solution for scarring, whether it be acne scars or surgical scars, is a little bit of a combined approach, which we will utilize microneedling and potentially laser. But overall, it's really great for age management for younger patients, melasma management, which we discussed, acne scarring improvement, and just in general, kind of a dull complexion or uneven skin tone. We're doing treatments to kind of even that out as well. A question just popped up as well about the number of treatments for acne scarring, and that's a great question. It really depends on the type of scar. So we have ice pick scars that go very deep. Those are very difficult to improve. We also have more of a box scar, which is, if you think about just a box in your skin, that is a little bit easier to treat. The easiest ones to treat are more of those rolling scars. So the more superficial it is, a little bit easier to treat. But there are more and more clinical studies coming out that include microneedling and different things to really help to address that. So during your consult, we can take a peek at what type of scarring you have, kind of what your goals are. In different areas, you're going to have different concerns. So we'll address the protocols based on what we're seeing and what we're treating. But this is our marketing manager, Haley, and she just had a treatment done on Tuesday. So she's just a couple days out. We tracked her progress before, immediately after, and 1 day post. And so I think it's really great just to see, I mean, you are going to be a little bit red from this. She has very reactive skin. So I would say that day, just kind of keeping your face clean. The next day, you'll see that redness really is subdued. It's just a little bit more pink. And she was easily covering that with a little bit of makeup.